yeah, he's an alcoholic, but this is my dad. Like, his daughter's sitting next to him. Like, have a heart.
Did she ever talk about your dad's disease? Like, did you know when you were young, like, that's why he passed? Or did you know when you were young that was his problem?
Wow, that's such a good question. You know, one thing my mom was really excellent at was she didn't character assassinate my dad. She didn't triangulate, you know, and like say negative things about my dad. So, but it was not a secret that dad had a drinking problem. Like it was evident. You know, I'd go and spend time with dad, and I even remember as a young girl, like one time there was a cup. He liked to mix cheap vodka and orange soda. That was yeah, like he was true blue. And I remember one time picking up a cup, seeing orange soda, and going, doop, doop, you know, I had a little sip. And I put it down, I went, alcohol. And I was just like, ew, how gross, alcohol. Like I had no desire to engage with substances at that age or with alcohol or anything. But it was no a mystery to me why dad was falling asleep on the couch or any of those things. But so she didn't discuss it explicitly, but it wasn't ever like an off limits topic or anything like that. Because I think the way that our parents talk about what's going on in our family is important too. Right? The way, like, what level of honesty or what level of transparency are we having with children when they're in families where these dynamics are present. And I think no topic was ever like off limits with my mom. And I even remember, so my dad did pass when I was 18, about to turn 19. And I remember about 2 years before he passed, he was an auto mechanic, and he was very good auto mechanic. And we were on our backs under a truck, and he was showing me something. That was one thing he was good at. Like, I knew how to change a tire, I knew how to change oil, stuff like that. But and we were sitting there together, and the topic somehow came up that the doctor he had spoken to recently, because he was always in and out of the hospital with pancreatitis, that the doctor he had spoken to said, if you don't get sober or if you don't stop drinking the way that you are, you've got about 2 years. And 2 years later, wow, he was gone. So, you know, but I remember being with him once in the hospital, because that was sort of that was a very present part of my middle school and high school experience, was dad being in and out of the hospital. And just the callousness that the medical staff that he was assigned, the doctor specifically, the callousness they treated him with, like the way that they dismissed him and were like so exasperated and frustrated with him, and how it came out in just not treating him like a person.
Wow. And you remember that?
I remember that. I do. I remember feeling so horrible for him, because I was, you know, yeah, he's an alcoholic, but this is my dad. Like, his daughter's sitting next to him. Like, have a heart. And that's one thing it was at the time, one of the reasons I wanted to become a doctor, because, and we'll get there, but I did want to become a doctor when I was younger. I was like, I will never treat people that way. And now, working in the mental health field and working with this disease constantly, I have an opportunity that I'm very grateful for, where I get to follow through on that promise, that I don't treat people that way. I'm not dismissive of them, and I'm not callous to them, and I'm not unkind to them just because this disease has them in its grips and won't let go.